Hey everyone, how are you doing tonight on this Monday? Trying to figure out where these flowers should go. I feel like I'm living in a flower shop and I am not mad about it. Let me tell ya. Just got this new mug. Very excited about my Westie mug. We are on a whole nother level here in the Auger house and I am, again, not mad about it. So I will let you all join and then we're going to have a deep conversation. And I promise, I'm not going to get political. I know, isn't it so cute, Laura? This is from my friend Janae, and I'm absolutely obsessed with it. If you have any friends that are dog lovers, it's actually from West Elm. And if you follow me on Instagram, Margot literally unboxed it herself by tearing open the box. It's very, very exciting. Another thing that last year, I'm gonna hold this up and I'm gonna like block part of it so you don't see my address. But last year, my friend Ross, thank you, Marguerite, for the little hair compliment. Not gonna lie, I was just outside and it was really windy and I had a hood on and I was like, I don't have time to do my hair, so hopefully it's fine. So I appreciate you. It's all about the cut. This is from my friend last year. It's literally a Westie outline that's like a return stamp for my friend Ross at PDT. He got that for me last year for Christmas, and these are like two of my favorite gifts ever. So can never have enough Westie. Oh my gosh, what is all these compliments? Thank you guys. Jeez, clearly y'all know I needed it. These glasses are from S-E-E. Great company. They're kind of like a Warby Parker, but they make less of each glasses. So there's like 100 of each, but I like it because they're very different. And these are like 3 years old and like, hey Rose, how are you? And I'll be honest, I fall asleep in them all the time. I do not take good care of them, so they are sturdy. Just saying, if you're looking for a good sturdy glass, let's see, make sure I didn't miss anything. Hey, Deanna, how are you? Hi, Kelly. Who else we got? All right, so let me know when you're on the live. Let me know who you are, where you're from, and let me know if you have any questions. There's a couple things that I want to talk about right now with dentistry as a whole and the numbers that I'm seeing. So I'm in the Boston area. I actually live south of Boston, so I'm in Massachusetts. And today our governor rolled back things that we can and can't do. So we're in a huge surge in Massachusetts. Part of that is because we had students come back to Massachusetts, and the other part is just that some people are taking the pandemic very seriously, others aren't. And again, I am not going to get political. So I just want to say that. It doesn't matter kind of who you're voting for. I just want to just make this very factual from a pandemic side. So I do believe that when we're in a pandemic like we are, I think rules need to be very strict and concise. And I think that if it's suggested to wear a mask, that everybody should wear a mask. It needs to be more regulated. I'm not going to get too far. I don't want to go on a political rant because that's obviously, this isn't my platform. This is RDH's platform. But in the state of Massachusetts, we are seeing a complete rollback. Today alone, in 5 minutes of each other, I had emergency alerts on my phone about, wearing a mask and about everything that was happening. So we are on a straight state restriction. We're supposed to be home by 10. And from 10 to 5, we have restricted hours. You can go out if you're going out for work. Hey guys, how are you? Hey Amanda. Amanda says, yeah, we're back in stage 3 since last week. Hey Christina, how are you? Same in Connecticut. Laura, yes, I am hearing a possible glove shortage. So I'm a part of a DSO here in Massachusetts, and my office manager has already had the conversation about using your gloves, your clinical gloves, for patient care, but then using your utility gloves to wipe down rooms. So we're assuming that that's going to happen. I mean, we've seen different shortages along this time. I mean, right now we're limited to the number of wipes that we have available in our practice as well. So I do believe there will be a shortage of that. It's so hard because I would love to be able to dive into all of the public health science that I've been researching. There's some really good documentaries out there. One right now is on Hulu. So it's all about the way the pandemic and the numbers and what's out there and cost of PPE and all of that. I would highly recommend that you watch that. I think there will be a shortage. If you would have asked me, and this is just my opinion, to be honest, my opinion. Hey, Ann, how are you? If you were to ask me, like, 4 months ago, do you think we would be shutting down again in the fall? I'd be like, oh no, like, we'll have it all figured out. Based on the numbers in Massachusetts alone, we are in a full-blown surge. Our numbers are triple, quadrupling than they were 30, 60, 90 days ago. So I wouldn't be surprised if we have to shut down for a bit again, if the numbers become uncontrollable. So I'm not saying that I think it will absolutely happen, but I think it just depends. So I would suggest that your office do have some sort of protocol of what the shortage looks like for wipes. I've discussed that on some other lives about pre-soaking and why you shouldn't be pre-soaking, like gauze packets. So if you're going to move over from, hey Mary, how are you? If you're going to be, numbers up in Illinois as well. If you're going to be implementing with the wipes, if you're going to be moving more towards a gauze, it would be recommended that you're spraying the gauze directly and not pre-soaking that gauze. Sometimes, depending on the gauze, it can negatively interact, and your sterilization product, your solution, your spray, won't be as effective, or whatever you're dipping it in won't be as effective. So just make sure that whatever you're using, you're reading the guidelines and you're being open to that. OSEP has a great manual. I can send you the information if you want on that. Margot's trying to get out again. She literally just went on a walk. I tell you, I got a toddler. Hey Celeste, how are you? I'm concerned that people are starting to avoid the dentist during the surge. Lori, that's been my concern. I'll be honest, the last few weeks I've had probably about, just in my chair alone, probably about 45 cancellations. My team is absolutely amazing and somehow fills them, but last Thursday I work Tuesday, Thursday, Friday, and last Tuesday I looked at my Thursday schedule and it was super light. I think I had like 2 patients in it, and normally I see anywhere from 8 to 9 patients. My team was able to fill it, but that literally took someone calling, like one person being designated to my schedule to fill it. So I do think we'll get a lot of last minute cancellations. Of course, the hard part with that is if patients aren't feeling well, we don't want them to come in. I think there is going to be, right now in general, we were concerned about this time months ago because of the fact of the flu, right? The flu and the COVID and similarities, and how do we differentiate? We really can't, and what does that look like? So we've been kind of prepping for these cancellations ahead of time and such. So I think it's just going to be, guys, it is what it is. Here we are. It's the year of 2020. So I think, depending on, again, not to get political, and I keep kind of hesitating on what I'm saying because I don't want to get political, but I think it does depend on the leadership that we have and the way the election goes in order to figure out if we're going to be able, what the pandemic numbers will look like moving forward, and if we can get a control on it. I don't know if you hear those jingle bells. Hey Megan, how are you? I feel like someone is about to have a little emergency, so give me one sec. I'm just gonna let Margot out, even though she literally just went. She's getting real serious with the ringing. So give me one sec. I'll be right back. Literally take me 20 seconds. I'm gonna try to do this without you seeing my sweatpants. I'm back. Guys, I've said this before, but I really do feel that every person who wants to have children should be required to have a dog. I'm telling you. Let's see, in Montreal, we're in phase 4, and 95 face shields, jackets. Yeah, so what we're talking about is the phases of opening in the United States. So, I think all of our PPE how is it in your practice is what I should ask you. Are you guys still wearing your respirators? Are you still wearing your surgical caps? I see some posts where, people are posting working chairside, and I'm like, where is your scrub cap? Based for me, after wearing my face shield and my scrub cap, I don't ever want to work without them. The fact that, number one, I can save so much time washing my hair every day because I'm throwing it up in dry shampoo and putting my scrub cap on is number one. Number two, it's just, when I look at what's on my face shield, I'm like, I never want to go back to the before. I don't want to be not wearing a face shield, I should say. Let's see. Patty, that's so sad. Worked at a dental office today in Florida and it was business as usual. No COVID procedure at all. So, Patty, what I am finding is a correlation between, I think the hard part with life right now is there's science and then there's politics. And from what I'm seeing is people are completely avoiding the science. The truth is, we know how to prevent the spread of the disease, and we should be having a different protocol. Now that we know more, we should be doing better. It's very frustrating for me to hear that, really, especially when I'm on video, because I feel like I can't not have a visceral reaction. Scrub cap, N95, mask over at face shield 2, great. Wearing all the PPE, and glad we are. Yes, Val, I love that. They aren't taking it seriously in Tennessee. I had an interview at an office, and they asked me how concerned about COVID I was, then began to tell me that they operate mostly normal before COVID, because they do not feel it's coming from dental offices. I turned down the offer. Heather, I am so proud of you. You do not want to work there. Do not want to work there. Jeez. Oh my gosh, let me just take a sip from my Westie mug. Yes, and good for Heather. Everybody. Heather. So here's the thing. If we all did what Heather did and put a stand down, I mean, I feel terrible for the hygienist who feels like they have to take that job. Because the truth is you don't have to take that job. And right now with temping, there's so many opportunities that you can do. And I've said this before, I temped until I found my current role. I absolutely love my current role. I really do. And it took a while for me to find a role in hygiene that I really loved and felt like I was valued and had the autonomy that I do. So I temped, and let me tell you, it's awesome. I mean, I know it's a little bit different now in COVID, don't get me wrong, but a lot of the temping services do have the verification of the PPE, and some temping services even go as far as giving you a protocol in the office of what it means to be successful. The assistants are over it and have decided they don't need surgical caps. Hygienists are still wearing them. It's hard, isn't it? It's very hard. I think that it's definitely put a spotlight on a bunch of leadership. I'm gonna have to excuse myself again on this live because I left the patio door open and it's like 2 degrees here in Massachusetts. So I'm gonna go close the patio door. It'll be 2 seconds. Keep talking. I'll be right back. Right back. All right, let's see. Hey Margot, how are you? Let's see. Hi Amy. In PA, we're not using power tools and hygiene at this time. I mean, I'm using all my power tools, don't get me wrong. I've gone back to the power. I've even pulled on my air polisher because I got the HVE, and I'm finding that more and more patients now, because they're not getting out, they're not having that social interaction, I'm finding that they really, it's like they have no, I don't want to say respect, maybe awareness. They're literally thinking that because we're in COVID, we'll probably be less busy. And sometimes we are, but I don't think they're taking into consideration of like how much time I need to flip the room, and like that I have other patients in my schedule. Some patients just want to sit and chat for hours. So what I'm finding is to be able to have, the better interaction, I really need to be using my power. So I'm using power with the air filtration and all of the recommendations from the guiding policies. I work in Florida. We've screened before, and at the end of the day, patients wear a mask. They enter the office, have extra oral suction, 5 surgical grade air purifiers. I'm so glad that you feel safe in your office, Samantha. That's such an amazing thing. Jane using power tools, using all the PPE. Great. So I think, what's important moving forward is that I've said this a lot before, is the fact that you should never feel unsafe in your practice. And if you do, start looking. And if you need help on how to diversify, how to market yourself, where to look, please feel free to email me. That's what I'm for. I don't want to see anybody leave hygiene because they feel like they believe the mindset that there isn't going to be somebody who's, a good practice owner for you, or that you feel like you can't find the right office. They are out there. So sometimes it's just a matter of changing your perspective about something, or really figuring out like what are your must-haves and what can you compromise on, and going in with that of a different mindset, I think has been really helpful for me personally. Like there's certain things, and I could go into this, extensively, but I've learned so much about my own mindset and how to work on a team and knowing when it's my time to support someone and meet them where they're at, and also that I'm not competing with them, that we're all on the same team. So, if I'm successful, so is every other woman in my practice. I work in the office of women, both offices, funny enough, but didn't notice that until I said it. But, if I'm successful, she's successful, right? And I think in dentistry, we get so burnt out. And I've shared with you how many offices I've been in that I've absolutely hated, how many doctors that I've temped for that I've actually cringed, walking out of the practice, or how many times a doctor has said something totally inappropriate to me about, oh, I hope you're ready to take me to lunch, or, I'm going to take you out. Oh, you're not married. Great. You could be my side hustle, literally in interviews. And I spotlight that as being unhealthy, but I also want to teach all of you guys how to identify what is healthy and believe that it's out there. Because if you're constantly living in the fact that you're never going to find the best office, that a dentist is never going to give you what you need to be successful, that's all that you'll see. That is all that you'll see. And I work for a DSO. The practice owns 50 locations. And at any moment in time, I can pick up the phone and call the owner, and he'll answer, and he'll make sure he leads Zoom meetings every week. He makes sure that we all feel good. He hears us out. He hears out the people who maybe considered the people who are focusing on the smallest minute detail, but he knows that they are nervous about something, and he'll listen to them. So that's just what the message that I really want to give you guys. I have a survey going out. I have an opportunity to speak to thousands of dentists specifically. And I want to show, I think a lot of dentists there's this big war in dentistry right now. And it's been there really before the pandemic, but now that's got this big shiny spotlight on it. And we should not be competing with each other, right? If your dentist is successful, if you're successful, it's going to be a win-win. Our whole point here is to prevent the progression of disease, prevent disease at its earliest stages, both orally and systemically, and to make a change and an impact in our patients' lives. And I think we just get so burned by poor communication, by, poor leadership or lack of, and I think people don't understand where the root of the problem is. If someone talks to you and they come across as negative or short or combative, oftentimes that's because of fear. So of course dentists are scared right now. They're practice owners. They've invested in so many thousands of dollars to make their practice more safe. They're concerned about their future. They're concerned about their schedule. When you look at our schedule in my practice, hygiene is obviously feeding the dentist's schedule. Well, if the patient's not in pain right now, they're we don't want to come back in for that crown because it doesn't hurt. And I've been watching it, I've been monitoring that area for 5 years and it hasn't gotten better. So even though there's craze lines on it, I don't want to come back in. I don't, I'm concerned about coming back in. So guess whose schedule is lighter? The dentist as well. And when people are in fear, they're not going to show up as their best self. So what we need right now is more communication from our practice owners of why they're scared, and just be open and upfront. You know what I mean? And I'm really grateful that I can have those conversations with the practices that I work in and be able to say, look, thank you so much for sharing that with me. I understand where you're coming from, and here's where I'm coming from, and let's be successful together and show up with more grace too. There's been times where there's different interactions no matter what office I'm in, where someone kind of says something to me short, or this past week I was running behind on a patient, and I rarely run behind because it's my biggest pet peeve. I think if a patient has the respect to come in the practice, on time, I want to be on time. So I'm here, I'm seeing all of these questions responses. Let me just see. I'm back at work since being from maternity to the office. I've been temping with asked me to reuse the KN95 mask. We do wear level 3, and I leave it in a paper bag for 1 week. I went out and bought my own. Where does the OSHA, the CDC say we can reuse a 95 mask and leave it in a paper bag? I missed this memo. Any ideas? Hey Tiffany, great question. So this is something that has come about during the height of the pandemic, and I think it really came from hospitals. As dentistry was closed, we were trying to figure out how hospitals were reusing their PPE. I wear my I wear a KN95 mask as well in one of my offices, then an N95 mask in the other. The KN95 mask we wear throughout the day, the same one, and then we dispose of it because we have enough. So we wear one day. Other offices are putting it in that bag. It was released, I really believe, through the hospital research. I haven't really seen much research on it, but I have heard that that was okay, and that's what many practices were doing. If you're wearing the level 3 over it, it's very helpful. There's other masks that have been out there, masks like disinfecting, which could be done through fogging or other technologies that are available with the hospitals. All of that, I have seen studies on that those do not work. So what the best things that I have seen, if you're going to reuse it, multiple weeks, would be to put it in the brown paper bag. You do have to be careful of, you're welcome for addressing. That's why I'm here, girlfriend. You do have to be careful though of where you're getting, if you're buying it on your own or even if your office is supplying it with respirators and KN95s, you want to make sure they're valid. Now, if you watched any of my lives during the pandemic when I first started going back to work, I was down for the count for a long time in regards to heavy migraines, heavy brain fog, just chronic fatigue. I still have a little bit of it, I won't lie. This Friday I worked and I was feeling, not so great over the weekend. Just like brain fog and like being overtired but not feeling like I should be that tired because I didn't do much. And I do equate that to wearing the respirator. Let's see. How long do you use the same N95? So we use the KN95 in one practice and then N95 in the other. In both practices, I wear them for the day and then I toss them because we have enough. Hopefully that makes sense. Let me know if you have any additional questions. So I do have a survey going out in regards to just, what hygienists want. Because I think a lot of dentists look at hygienists and think that we really just want, thank you, Angie, for posting that. I literally was like, I have something saved on my computer. I will put that in there. Thank you so much. And I think most dentists assume that we just want to get paid a lot and that, we don't want to, that's what we're in hygiene for. But I think what it really comes down to is what office you can feel respected and collaborative with. Let me know in the comments below how you feel about that, because I do have a big seminar coming up directly for dentists, and my topic is the toxic culture of dentistry. And I want to be able to just bring light to that. Let me know if you have any questions. I'm really excited about these flowers that I got. They're literally a week old from my friend Cherie from Armor Dental. Shout out to Cherie. She did a photo shoot and she needed some scrubs and I was like, I got you. And then Laura, thank you so much. Agree 100%. Feeling valued is very important. Yeah, I mean, I didn't get into hygiene to, just fluff and buff, right? And one of my favorite parts of my job is to being able to collaborate with my dentist and to come up with a customized treatment plan for each patient based on their specific needs. So let me know in the comments below if you have any additional questions, and then we'll go from there. I work in an RDH-owned practice, thank goodness. And that's fun. Tell us more. Struggling with a PureVac, any tips? Absolutely, tons of tips. So with the PureVac, I absolutely love the PureVac for the lingual surfaces, and I find that a lot of you are DMing me about it. The lingual surfaces is like easy breezy. When it comes to the buccal, what I find is I use it as a retractor. So I'm putting the mirror portion of the PureVac system towards the tooth surface and using the back end of the PureVac to retract back, and then having the patient close a little bit, and I stabilize right on like the buccinator, the fat. That's how I use it. Let me know if there's a specific area that you need help with. What I also find is that if you when I'm working on the molars, I like to have that PureVac as far back as I can. And then when I'm on the premolars, I like to stabilize or fulcrum like two teeth. Like if I'm working on the premolars, I'm gonna fulcrum on the first molar. Does that make sense? Wow, who knew English could be so hard? Anna, I had to purchase my own KN95 and I'm thinking about purchasing disposable lab jackets because my boss said that he has to draw the line somewhere. Disposable lab jackets are still on back order for most offices. What we do in my practice is we wear washable lab coats. We wear it for the first half of the day, one, and then we switch at lunchtime and then wear another for the rest of the half of the day. If you have enough to wash every patient, you also could do that. Yeah, it's hard. It's really hard. But again, I think where it all comes down to as well is we have to compromise with one another. I mean, the dentists, now I will say some dentists don't seem to be making a lot of changes. I will say that because I read all your emails. But I will say I think a majority of them are trying their best. And sometimes it's just a matter of not being able to get the materials. Not that they don't want to buy it or they don't want to purchase it. It's a matter of being able to get it, number one, and then the surge of pricing. So there's a really good Hulu documentary right now called We Have It Under Control. I would highly recommend that you take a look at that. Let's see. Live in Colorado, we have doxes in place too. I love that. Do you know how many times you can wash a reusable gown? So I'm not sure what you mean by that. These are like actual fabric lab coats. Is that what you mean? Margot. Children. Is this universal? Okay, so that's for Angie. Don't do that. Come here. She literally found her dog bags. What else we got, guys? Anything, ladies, gentlemen? What else you got for me? I am ready. I am ready. Surgical plastic gown. How many times you can reuse it? The question I thought was how many times you can wash a reusable gown. It's plastic, you can't wash it. Let's see, Joy, if you are performing AGP, or tell me what AGP is. Should you change the gown between each patient? AGP, I feel like I should know that. Is that scaling replaning? AGP, what is AGP? Guided biofilm therapy would be GBT. Tell me more. I feel that assistants and doctors' PPE protocols are getting more and more slack even after our meeting and discuss the office policy. Anything that I can print to bring in. I mean, you can just type into Google infection control, chain of control. I think dentistry, COVID-19 and dentistry is a great group on Facebook. There's a lot of cases that are aerosol generating procedures. Thank you, Jennifer. I was like, I feel so dumb. I knew it was like something simple. If you are performing that, yes, you should. If you're performing any aerosol generating procedure, you should technically be changing your gown each and every time. In the height of the pandemic, our office decided on some protocols based on the science and based on limitations in the practice of how often we should be changing. So the standard is to be changing each and every time. Keep in mind, if you are using your air water syringe, you are generating aerosols. So that should be changing each and every time after your patient. In regards to the PPE and what you should be bringing in, Lynn, for information, I would just simply go to the CDC. I mean, there's so much, the ADA, all of those protocols. And I think sometimes it just takes you saying that you're uncomfortable and explaining the fact that even if you in your room, you're doing all of these procedures to keep yourself safe, but somebody else isn't wearing their surgical cap or not taking it seriously, then they come in, they can contract it. And then when you're eating lunch and when you're in shared spaces, like at lunchtime, you're, drinking your coffee in the morning, et cetera, you're liable. In addition to that, if you don't have proper air filtration in your practice, you could be essentially inhaling the same bacteria that's being aerosol generalized in one room to another through the vents. So there's a lot of things that you can bring in regards to that. I think sometimes it's a matter of saying or pitching it that you are concerned, and here's why you're concerned. For me, I get a lot of, even this past weekend, I get a lot of, I was talking to someone and they said, I said, I've probably seen the same 6 people since March. And she was like, oh, honey, I am so sorry. And I was like, why? I'm like, we're in the middle of a pandemic. I'm taking it seriously. I'm a single dog mom. Sure, I could be out going having fun, but I don't want to. The reason is because I don't want to potentially be a carrier of the virus to not only my coworkers, but all of my patients. So it's very interesting, the differences out there. Our gowns are shower curtain material over a cloth, like a material are level 3. However, I feel like we have washed them so much since returning. Oh, sorry, Lori. I have no idea, Lori. I've never heard of a curtain material that you can wash specifically. I mean, I don't know why this is happening. Hang on. I have like all of these things. There we go. Still non-generating procedures in Canada. And we got some questions. Great. Lori, I would just type into Google the brand, if you know the brand and the model of whatever you're using, then I would type that into Google and see what they say for how many times you can reuse it, how many times it can be washed, et cetera, and go by the manufacturer's recommendations. That's my recommendation for everything, because depending on how the product is made, depends on how it can be used and the limitations and all of those MDS sheets. So, some questions coming in. That's not a complete question, so I'll just wait. You might have hit enter by accident. While we're doing this, Margot has literally found a box to rip up on the carpet. I mean, I can't complain. She's been like sleeping most of the day underneath my desk, so. Trying to get a workout in tonight. I don't know if it's gonna happen. I feel like once daylight savings times happens, I just want to sleep at like 7:30. I live for summers. I also don't know why I'm still in New England this time of year. So if you want to build an in-law space, your house for me and Margot, we may move in if you live in a sunny area, you know? All right. Would you say 4 uses should do it for a K95 mask or no? Or more? So it depends on how long you're using it. So when you look at the respirators, it depends on how many times you're donning and doffing of the respirator. So that's what I would say. Carrie, we would love to come and stay with you, but we're about to go on like full-blown lockdown again here in Massachusetts. It's a matter of time. The emergency alert system was activated on my phone twice today in a matter of 5 minutes apart, telling me all about the new restrictions in Massachusetts and how we're not allowed to leave the house after 10 p.m. unless it's for work or medically deemed necessary. Yeah. I do like the airflow, love the airflow. Care in our offices, turning any patients away that could be sick. Ours are. So if you have a cough, you have a fever, you have any sort of flu or COVID-like symptom, you are not coming in. Some patients lie in their pre-registration, and then when we ask them verbally, or even I've had people be like, oh no, I haven't traveled, and then they sit down and I'm like, oh, how was your weekend? Like, oh, so great, I was in Florida, and I'm like, hey, see you later. You're not coming in my chair, I'm not treating you. So that's just our office protocol, but I'll be honest, I do feel very comfortable in both of my practices that I could say to the patients, hey, I don't feel comfortable treating you today because of X, Y, and Z. And I do feel like both of my office managers allow me to have autonomy over that. I've treated one patient since coming back that called and said that they were alerted that they were at an event with someone who did test positive for COVID-19. They got tested and there was no issue there. So I was really grateful for that. All right, let me know if you have any more questions. I'm gonna do two more questions. Carrie, how's your day going? Do you like my new mug? If this pandemic doesn't end soon, I'm gonna end up with another dog. I'm telling you guys right now. Good evening. Hey, Michelle. Hi, Margot. Oh, Margot and Michelle said hi. After Monday, I order my loops and I can't wait to get them. Thank you all for your help. Oh my gosh, my pleasure. Michelle, please send me a picture when you get them. I can't wait to see them. Cannot wait to see them. Margot's staring at me. Come here. You want to come on the live? Do you want a treat? Come here. I also realized that my pockets are no longer my pockets. They literally are just made for dog treats. Like, thank you. Love the mug too. Oh my gosh. And Carrie, you've been swimming all day. Come here, Mark. Everyone wants to see you. Come on. Up, up. Come here. Are you being camera shy? She sat on a lot of Zoom calls today, guys. Oh my gosh. I don't know how I'm gonna go back on the road without being able to see my Margot. Only accepting speaking engagements that allow me to bring Margot. Look at this face. We're totally overdue at the groomer, and she totally shamed us for not grooming ahead of time. She's like, this is why we book ahead of time. And I was like, listen, I didn't realize Margot's hair was gonna go through a growth spurt. She's very embarrassed. Are you embarrassed? You wanna show everyone how you snuggle? Can you show them? Let's see. Perfect. Margot, you wanna snuggle? You get a treat. You gotta show everybody how you snuggle. Let's see. Recommendations on a new shield. Is yours the Loop Saver shield? I love the Loop Saver. Those that I had for the Loop Saver were really disposable ones. Right now, I'm trying to think of the name of it. It's the red. It's got like a red logo on it. I have two. I have one from Meisinger that clips to my loops. And then another one, Heather, yes, my schedule is very light for November and December. Optics. If you email me, just email me because I'll forget. Email me and I'll get it to you. Optics loops, Loop Optics. I think it's Loop Optics. It's the big clear one on the top, and it's got white, and you can just easily flip it up and down, but it like extends. I saw it through an Instagram ad. Not gonna lie, that algorithm knows me so well. It's not good. Not good. Let's see. Great. I love how you guys are just chatting to each other. So fun. Love it. Multiple conversations going on at once. Margot just finished her last treat, so she's gonna want to bail out of here any second. Let me know if you have any more questions for me. Otherwise, we will see you all here next week. Right? Say hi to everybody. Oh, she's seeing the comments come in. Who's that? Who's on the camera? Say hi, everybody. I remember what you're talking about. Okay, great. I think it's like optic loops or something. It's got like red in the logo, but it works really great. And then I switch that up with the Meisinger one and then that one. I really do like the Meisinger one, but I find that if I wear it like day after day, either one, ultralight optics. I think, Kelly, it is ultralight optics. It's a clear shield. Everything is like white. Everything's white for the plastic, and then it's an easy up and down. The sides have something that looks like a bolt. It's just got like a screw in it. It's just like one slide, like a Phillips head screw, and that's supposed to be for your to be like an ear saver. I don't use it like that because I feel like when I use that, then it hurts. It hurts my head. Yeah, so hopefully that helps. All right, I've run out of all steam. I've hit my time. Thank you all so much for joining. I'm interested to see where we'll be this time next week and see what changes. And I will be here for you through all of this. You can get a shield extender that goes under your chin. I'm not into that. Thank you, Julie. I'm just not into it. I find I have a plastic piece that goes in. It's called an ear saver that clips over my surgical cap that I really like. I'm about to start using the laser. Any tips? Yeah, tons of tips on the laser. Just email me. I'll give you a ton of them. I love using my laser, and I train around the country, so if you need laser training, you let me know. But I absolutely love it. I'll just give you a few pointers now. It depends if you're going to do non-initiated or initiated. I think the biggest thing to be educating with your patients is the fact that the laser is going to be attracted to the dark pigment. The dark pigment is found in the bacteria that lives subgingivally and lives in an anaerobic environment without oxygen. That's how I say it to my patient. And then the light is going to be attracted to that. It's going to heat up the cell wall so much so that it bursts, creating cell lysis. And the most important thing whenever you're doing any sort of scaling, root planning, treatment, of course, is the fact that you're engaging your patient and figuring out what they are going to be implementing each day for the biofilm removal. Because you can laser and scale your little hearts out, but we all know 80% of the success of periodontal disease is going to be from your patient's home care. Sarah, yes, we are dismissing patients who have traveled outside of the country. Can you repeat your email? We got a laser and training. Sure. AmberAugerRDH@gmail.com. So AmberAugerRDH@gmail.com if you want more tips on using a laser. All right, guys. I can't do it. I can't do it anymore. Been on Zoom calls all day. I feel like elementary or high school student, middle school student. I feel like you're children at home who just cannot be on the computer anymore. I'm hit my max. But I'll be here next week. We'll do 6:15 next week, just like we did today, Eastern on Monday. If you have any questions in the meantime, feel free to email me, AmberAugerRDH@gmail.com. Otherwise, have a great week. And so proud of you all for just continuing to be resilient. So excited, and just, make sure you're taking care of yourselves. Like, I'm going to go to bed probably like 8 p.m. tonight. Take care of yourself so that we can really fully be maximized with our patient care. They need us now more than ever. Have a great week.